Well, one man was killed, another suffered life-altering injuries yesterday morning in what police are calling an unprovoked and random attacks in downtown Vancouver. Now, the suspect, a 34-year-old White Rock man, was arrested about an hour after the attacks occurred. The mayor of Vancouver spoke with reporters yesterday following the incident, and he praised the work of police and said Vancouverites were sick and tired of violent incidents in the downtown core. Well, Vancouver Mayor Ken Sim has been good enough to join us in studio this morning. Good morning to you.
Good morning.
Do we know, first of all, anything more about the victims or the assailant in yesterday's attack? Have you learned anything else?
I personally haven't learned anything new since last night, and until the proper individuals are notified and what have you, you won't see that coming.
Okay, and have you been in touch at all with the survivor in this, or have you been able to reach out?
No, I haven't been able to connect yet.
Okay. You said yesterday that we need to pivot our approach to public safety in downtown Vancouver. What exactly does that mean, we need to pivot?
Okay, so I do want to let everyone know, like especially the victims, the family, the friends of and even people at the CBC here. You had a front row seat to this. Our hearts and thoughts go out to everyone affected by this incredibly terrible, heinous event. And so when we talk about pivoting. Look, we can talk about how, and I know people aren't ready to hear this yet, and no one really cares. Okay. Vancouver is still a safe city, and crime and violent crimes across the board are down. But it doesn't matter. When an event like this happens, it shakes everyone to the core.
Sure.
And so the specifics around this one is there's someone with a significant mental health challenge that has a history of interactions with the police.
Mm-hmm.
And, if you want to get to the root cause of these issues, these are not actually policing matters. They're not things that the city of Vancouver can address. These are issues that are the responsibility of senior levels of government. And we're not assigning blame here. Who cares what's happened in the past? We are at the place we are right now. And so we're assigning responsibility. We need senior levels of government to step up. We need to be having conversations around mandatory care, getting people off the streets who need it and getting the care that they need, so we are not put in this situation. Because if we do not do that, I can tell you one thing, and this is a guarantee. We will have more news conferences like the one we had yesterday, because as not just the city of Vancouver, but municipalities and cities across this country, be it Toronto, Nanaimo, White Rock, Kelowna, Calgary, we don't have the tools to get to that next level, to get to the root cause of why we're in the situation in the first place.
You said a moment ago that this is not, at this stage, this is not a policing issue. 2 years ago when you campaigned to increase the police force by 100 officers, you also talked about hiring 100 mental health nurses to be working in the streets of Vancouver. What happened to that?
It's been a little slower than we'd like to. We've hired about 20 now, and I want to give credit where credit's due. So the province has stepped up. They've helped us because for us to be able to hire those nurses and for them to be effective, we needed support from the provincial government. We needed access to the medical health records of individuals. We couldn't do it on our own. So giving the province credit, they've really been great partners on that file. And yes, we have not hired the 100. Now, when we went to the health authority, they came up with a modified plan, which reduced the numbers. And I'm going off memory, so I can get you the correct numbers, but I think it went down to 58, and there's a deployment strategy. We still haven't hit those numbers, but what I can tell you with the people that we've hired and where they are, like we have some individuals in the triage center, for example, we're having positive effects. We've had an impact on what we can affect.
But you're pointing fingers at the federal and provincial government saying we need help to deal with this. This is not a policing issue. We need to get to the source of this. And and when you campaigned to put more mental health workers on the street. These 20 mental health nurses, you say, have been hired. In what capacity are they working? Where are they? What are they doing?
Well, you can look at, Car 87, 88, and I went on a ride along and as an example and saw them in action. And so on the ride along I went to, we actually, the team actually, I just want to make sure I don't breach any confidentiality here. Got a call from family members of someone who was on the verge of a mental health crisis, and we met with the individual, and we got the person to agree willingly to go to the hospital. And so that was a great example of something being very proactive.
And where are the other 19 nurses working?
Yeah, I don't know the actual details of where they're actually working, but we do have some people that are working in the VPD call center, for example, and what they're doing, and I forget the number, but they've rerouted literally hundreds of calls that would have previously been, police calls to healthcare related, options. And so what we have to realize here is this is something that, we think is effective based on the data, and it's been proven out. And so if we want to scale this, that would be one part of the solution. But we have to realize as well is to scale anything that's healthcare related, these are not in the jurisdiction of the city of Vancouver.
But then why would you make that promise? I mean, I think people told you at the time that it wasn't within the jurisdiction of the city of Vancouver, and yet you continue to make the promise.
And that's a great question. So what we had to do is we had to think differently. We couldn't do what we did in the past. And so we said we are going to hire mental health nurses and prove the case out. And we have proven the case out. It is effective. We need to scale it now. And so what we want the senior levels of government to do is, and it's not just a Vancouver thing, we should scale this across the province. We know it works.
There was something else that you promised 2 years ago, which was, and this just speaks directly to what we're talking about today, an ABC majority will call for a mental health summit with all Lower Mainland mayors, the premier, relevant provincial and federal ministers, First Nations, health authorities, community service agencies, and community members, with the goal of establishing predictable funding and the creation of a new mental health center of excellence through a regional model of care that incorporates treatment and recovery. What's happening with that?
More to come on that in the very near future.
You've had 2 years to work on it. You can't tell us anything about whether this is going ahead. Have you had meetings?
We've had a lot of conversations, and there's more to come in the very near future.
Okay, can you give us some clue about what's been done to that end, to that effort? I mean, you made a very clear promise there.
Yeah. Well, I can talk about it in bits and pieces. Obviously, there's some conversations that are ongoing right now. And through some of our conversations, we've already had meaningful impact. Without that summit, for example, the mental health nurses, as I mentioned, the province has really stepped up. We needed the health authorities to come on board. The de-encampment of a very dangerous situation on the downtown east side, pivoting, lobbying the provincial government to pivot on decriminalization. So we have the tools in place where we can address, certain situations where, there are inappropriate things going on in playgrounds and parks. Now our police officers have tools. The list goes on and on. There are conversations going on right now.
But what does this have to do with establishing a mental health center of excellence?
More, we're going to be having a few announcements in the not so distant future. More to come on this. It's coming, Stephen.
All right. Vancouver Police Chief, you of course were part of the news conference with him yesterday. He talked to the media yesterday about the arrest of the suspect. I just want our listeners to hear a little bit of what he had to say.
And let me just say that there have been a lot of things that we have done. We've had really good success. Vancouver is not dying. Vancouver is not dead. Vancouver is not unsafe. That's all hyperbole, and it's not actually factual. There will be in any big city in Canada or North America, there will be shootings and stabbings and acts of violence, and this will not be the last one, and no city in North America could ever purport to not have any more crime. So there will be more violent crime that happens in a city the size of Vancouver. What I will say is that our crime numbers are way down, and I gave you the numbers. We will still have crimes like this that will disturb the public.
Now, that said, you agree obviously with what the chief of police has to say there?
Absolutely.
Okay.
But And I also want to say, we understand how people are shaken right now. So we can talk about crime going. He's absolutely 100% right. And the feeling that people have right now is natural. People are shaken.
No, I certainly understand that. And something like this would absolutely shake people. And I know it's difficult to think about overall crime going down when you see an individual, incident like this. My question is, what is your party's approach going forward? I mean, given that, you have the reality of crime going down on one hand, and then on the other hand, you have the reality of what people encounter on a daily basis, or the things they see in the streets, with the perception that people are unsafe versus the fact that we see a reduction in crime. What do you do about that?
Well, we do everything that's in our power. And so, we focused on reducing crime and violent crime in the city. And that's one of the reasons why we made a big, commitment to public safety. And we're seeing the dividends of that. As the police chief mentioned, overall crimes down 7.4%, violent crimes down 7%, property crimes down 10.3%, unprovoked attacks, stranger attacks, despite what happened yesterday, are down over 50%. So we do that. Also, we lobby senior levels of government for the next phase of what we need to do. And when we do all of that, the place will become safer. And the police chief is absolutely correct in his comment that even when we do all of that, we will not eliminate 100% these events. We are a big city and we're just getting bigger. And so, we can do everything in our power to make the place safer, and there will always be a perception. And we want to get it, reduce it significantly, but there will always be a perception in bigger cities that that sometimes the place isn't safe. We will never get rid of that. I'm sorry to say that, but that's just the reality. But we can make the place a safer place.
Mayor, we'll leave it there this morning. Thank you so much for coming in and taking the time with us. We really appreciate it.
Thank you very much.
Thank you. That is Ken Sim, the Mayor of Vancouver.